And now it is my pleasure to introduce our first speaker this morning, Assistant Secretary on Aging, ASA Greenlee. Many of you know Kathy very well already, as she has been a longtime supporter and advocate for and friend to the Aging Network. Before assuming her federal role, Kathy served as Kansas Secretary of Aging and as the Kansas State Long-Term Care Ombudsman. She also previously worked as the General Counsel of the Kansas Insurance Department. Her commitment to the network was endorsed by President Obama when he tapped her to be Assistant Secretary for Aging in 2009. In 2011, she assumed the role of the Administrator of the Administration on Community Living. At ACL, Kathy has been instrumental in building the capacity of the National Aging and Disability Networks to better serve older adults, caregivers, and people with disabilities. In addition, she has maintained her commitment to promoting and preserving the safety, dignity, security of older Americans through her elder justice advocacy. As a result of dogged and unswerving efforts, Kathy and her team secured support from both the President and the Senate Appropriations this year for first-time funding for the elder justice activities. That was a great accomplishment. We are thrilled to welcome Kathy to the Lone Star State and have her share with us the latest thoughts on what new business opportunities the Aging Network needs to explore and embrace. Kathy?
Thank you so much. Good morning. I feel like I can't see over this, so let's do this. Thank you, Dick. Thank you, Sandy, for inviting me. Were you here last year? Except we weren't here last year. We were in Louisville. Do you remember my promise? Here are my red boots. I've waited all year to come back. I already had the jacket, so it's working out. I don't have a hat. I might have it on this morning if I had a 10-gallon hat, so it's good to be with you in Dallas. It's become an annual tradition. So I will always count. I talked to Sandy. This is my 6th time to speak with you. So we are starting the 6th year. But there's someone here who's served in this position longer than I, and I saw her walk in. Josefina Carbonell, I'd just like to recognize you this morning. I saw you walk in. Josefina, sometimes they take our picture. You're wearing this lovely yellow, and I've got this red on, so we should do this morning. About 3 years ago, when I finished my speech, quite literally, I left. I called a couple days later and said to Sandy, now next year, I want to talk about evidence-based programs. That was a couple years ago now. Dr. Howard Koh joined us, and Dr. Koh has announced that he's leaving the department at the end of the month. And he's been a tremendous supporter of evidence-based programming and the work of the network. So that year, I kind of knew ahead of time what I was going to talk about. Some years I start thinking about this in the spring, come up with the theme. This year, I finally got around to it last Friday. This has been a really crazy year, and it has been as chaotic for me as it has been for you. So I thought perhaps my theme today should be, quite honestly, creative chaos, because we're all living in it at the same time. These changes that we're experiencing are happening with such rapid speed. You all are spending a lot of time, have already on the opening weekend, spending a lot of time in this conference talking about the rapid transformation. These changes are fundamentally changing the nature of our program, changing the way we staff our programs. There are movements forward. There have been setbacks. I think we can talk about those in the last year. The changes impact the people that we serve, and in a very fundamental way, like it has for me, it can really hijack your calendar and can all of a sudden sort of change the way you need to respond and work. And somehow through all of this, we have to continue to navigate through the chaos, find opportunities, and continue to figure out how to support the mission of serving older adults, for me, people with disabilities, and also their families, and keep hanging on to this sort of direction and mission that we have. So since this is how my head kind of feels, I'm just going to talk about kind of what's happening, sort of the swirl of things going around in Washington, in the country, and really use this as the opportunity, as I do every year, to give you an update about what's happening, similar to the intro that you saw about the policy conference, because I always come talk at the policy conference. So let's start way back when. It's not my first time to Dallas. I came here in my first year to do a listening session for the reauthorization of the Older Americans Act. So I wanted to talk about the Older Americans Act. We spent a great deal of time going around the country, getting public feedback on our website, hearing from people directly, getting your feedback about the kinds of things we needed to change in the Older Americans Act, and had every hope and expectation that we could move forward and get the Older Americans Act reauthorized, and it's not been reauthorized. There has always been a great deal of interest on the Senate side, and it's always been amazingly quiet in the House. Really, the interest has been almost completely from the Senate. The Senate Help Committee did pass the reauthorization, and before it can move to the vote at the Senate floor, something else happened to it. About the same time that this finally got some momentum, we went through the sequester, where we, through our Older Americans Act programs, cut in excess of $100 million of direct services out of the Older Americans Act. These were very difficult days. We still live with those sequestered cuts. But what the sequester did is revealed the complicated nature of the funding formula that we administer as we deliver these programs in a formula way to the states. And because of that, the cuts didn't fall on the states equally. And some states received double-digit cuts, while others had a minimum cut of about 5%, which was the minimum. And so we entered, because of the sequester, kind of an unforeseen conversation or disagreement over the basic funding formula. And as you could imagine, because if you're working at a state level or working at the local level, funding formulas are really complicated, because whatever you do to change, some people will get more money, some people will lose more money, and it becomes very hard. Our position at the administration is not to make decisions on the funding formula, but to provide technical assistance and advice to the lawmakers as they make these changes. This is currently where the reauthorization sort of resides. It's stuck because of the funding formula. Being concerned about the funding formula, I think, is an honest and legitimate concern. It's always easier to resolve those issues as a program is growing, because then you can create a hold harmless, you can increase the money and no one loses. It's very hard to do that at this point when the program shrunk and then at least the nutrition program rebounded somewhat. So that's where it is on the Senate side. On the House side, it's still very quiet on the House side. And those of you who come to Washington and talk to your legislators, I know are working in a bicameral way, going to House and Senate, but it's very quiet on the House side. What we're starting to hear is just a general conversation from some of the aging advocates, some of the network, about whether or not there would be support for what they're calling a simple reauthorization, not making any changes to the law or making very few changes to the law, and just trying to find a way to get it passed. I believe, at least what I've heard, that the conversations that are happening on the House side are more along that line. Can we just do something to keep the law moving? For me, it goes back to kind of some of the issues that came up when we did the listening sessions. And if you were there, they all went the same way. I started every listening session and said, this is about the way the law is written. And then we spent all day talking about the way the law is funded. And then I would close the day saying, and this was supposed to be about the way the law was written. And I tell you that because fundamentally, the issue that we have all struggled with more than what's written is whether or not these programs get adequate funding, because we all believe they don't. And the funding and the appropriations continues to be, I think, the biggest challenge for us. I don't think the law is in the way. I think the funding is really critical. I think that was revealed during the sequester. What I think, so my own perspective on lack of reauthorization, my disappointment about that is actually not about what we write down in the law. It's the fact that the reauthorization really provides us an opportunity every 5 years as a nation to talk about the value of these programs, the value of older adults, their role in society, the types of supports that they need. It's the conversation, to me, that we've missed. And that is the biggest disappointment. And the reauthorization is a grand opportunity to dream. Whether or not we come up with a change in the law, but can we all dream together, and can we engage Republicans and Democrats and members of the House and the Senate and at the state and at the local level? Can we dream together? And we didn't really have that opportunity because the reauthorization at this point has stuck. I still think we need that kind of a conversation. We need to talk about economic security and health and elder abuse and long-term care and housing and transportation and all of the issues that we struggle with as advocates that we know older adults are dealing with, the fundamentals that we need to put in place. Well, by coincidence, we talked about reauthorization when I started. And next year, in 2015, which will be the 7th year of an 8-year administration, the administration will support and will host the 2015 White House Conference on Aging. This to me is the opportunity. I mean, a White House Conference on Aging to me is the opportunity to have the conversation that we've all been wanting to have. And the White House is very engaged. I didn't arrive yesterday. I'm not going to scoop the White House on their own news and information, but I will tell you that they are actively involved. We have been actively working to hire an executive director to work on kind of how we put together the structure, how we get public engagement, how we use technology, because the White House is very interested in technology, as they should be. How do we do this in the course of the next year? So, to be continued. Wait and watch and see, but I spend a great deal of time now working with the White House, advising them on what we can do to put together a White House Conference on Aging. So I will let them give the specifics. For me, this is a nice bookend, that we talk about reauthorization closer to the beginning of my time serving as Assistant Secretary, and we will talk about this White House Conference on Aging and kind of implement that closer to the end. That's sort of the arc of our need to talk about aging. In the middle of those, though, has been all of this huge transformation that we're going through, all of this work that's taking place that I would now like to turn to. I am really curious about and very proud of your Aging Innovations Award. It's what's your Aging Innovations and Achievements Award. And I'm going to stand and help give out these big checks like this, like I have for several years. And I know you had your banquet yesterday, and I've got the brochure that lists, and you all are doing such wonderful, wonderful things. I don't have time to come visit you all. I honestly would like to, because seeing what you're doing on the ground really helps inform my work. I just don't have time to do that. And I'm going to run around the nation and do a White House conference next year. But I don't know how you choose who wins. Because for me, Sandy, including us, we all need first place. I mean, everybody's doing this work. We're doing this work. The states are doing this work. Your members are doing this work. And this transformation has been rather remarkable. So we are tackling and working with a select group, because we weren't funded to do this, of local AAAs and other partners to talk specifically about business acumen. And business acumen is something I talked about last year, is something we will talk about next year, is something you all are providing more resources for. Business acumen is so fundamental to the ways that we're needing to change, and represents probably better than anything else the transformation that's happened since I came to Washington more than 5 years ago. The need to really look at our business model, how we figure out how to price and market and sell, and these are not concepts they talked about in the past, but how we go about figuring out what our best skills are and how we can sell those to a country that needs them and is willing and able to pay for them. How we find new business opportunities with health plans, how we take advantage of the changes happening at the state level with Medicaid. One of the things in the last year that has been sort of emerging through this conversation, I have seen it at least, is the increased presence of foundations who are very interested. And I want to give a shout out to the SCAN Foundation, who's very interested in this, has funded national work, has funded a lot of work in California. SCAN understands the need. The Hartford Foundation has come to the table to be an incredible support for us so we can bring together the people that we're working with. Hartford and SCAN are two of the forefront leading organizations, foundations in the field of aging. And because of their interest and because of the work of all of us, we now have the interest of other foundations, community foundations, who are coming to the table. Each of you should go back to your state and find and and build relationships with your foundations, whether it's a community foundation in a city or a state health foundation. We recently had a wonderful call with California Health Foundation at ACL. I mean, this is really where we're finding opportunity. And this is new for us. Right after the Affordable Care Act passed, I got a call from Andy Allison, who was the Medicaid director in Arkansas at that time, and he led the National Medicaid Directors Association. He said, we've got all these foundations who are showing up, and that happened early on. right after the ACA passed, that the foundations understood that they needed to figure out a way to partner with Medicaid as Medicaid was changing. The foundations didn't knock on our door early. They've come to the table more recently, and we need to take advantage of what they can do for us, because they can help bring to us the expertise that we need to be able to analyze the business changes, and they can also be advocates for us as they interface with health plans. Could I have some water, Nick? So foundations are key new partners. If you haven't met with foundations, you should, and you should continue to talk to your quality improvement organization funded by CMS. And we talked about this for the last couple of years, that QIOs can be helpful. We are always looking for people who can translate between communities and health plans, and QIOs are essential in that. One of the things that's become obvious, both in working through the business transformation work, the business acumen work, and through the experience that many of you have had in the last year through the CCTP, the Care Transitions Program, is that technology continues to be, it feels like a boulder, not a rock, that we stumble over. And technology is a huge issue. We need to talk about how best to tackle this. Almost feels like a boulder we need to break apart. The technology issues, thank you. Oh, look, they had some back here for me. You could have just told me that. That's good. There's 3 of them. Okay. I can talk all morning. So for technology, as I have spent time talking to our colleagues at CMS and talking to those of you who've been working on the Care Transitions Program, technology continues to be an issue. And what I see is that as we step forward with a business model, wanting to find new partners to provide services to new clients or customers, people, we have to have access to electronic health records. And what I'm starting to see between those of you who've been able to kind of navigate the Care Transitions Program and kind of make it work, not lose money, is that access to electronic health records is the secret, and it shouldn't be a secret. We have to be able to interface with our technology. If we have to spend all of our time investing in and building this technology, we have these sunk costs that we may not be able to recover, and so we have to continue to talk about technology. We have a wonderful new director at HHS in the Office of the National Coordinator of Health Information Technology, Dr. Karen DeSalvo. She was the head of the health department in the city of New Orleans, and she joined about 3 months ago at HHS, and she gets us. She understands that for technology to work, it has to be the patient who owns the record, the records have to be portable, that you have to have technology that you can move among different provider types, and it has to connect to us. So one of the things that we're building into the business acumen work that we're doing in the next year is better partnership with ONC, that's their acronym, to figure out how we talk about kind of the world of technology that needs to develop. And this technology issue is so big you can have an entire conference on it. So you have to kind of break it into chunks. One is the interoperability of the electronic health record. The other issue of technology is the resource that we need, what we need to build in order to run our business and have good systems in our business. So you can operate, you can send emails and files back and forth to the hospital, but if you can't manage your cases electronically and track people electronically and track outcomes, that's another investment that you have to make. And then the other kind of item that's huge that I haven't spent as much time working on, but I see coming in a rather random fashion, is the whole role of technology in supporting consumers, the consumer experience. On Wednesday morning, you're going to have a chance to meet Sharon Lewis, who is our Principal Deputy, Secretary's Advisor on Disability Policy. She is a wonderful partner and colleague for me to work with, and this is an issue that she's particularly interested in, because what we see happening out in the world, both from the fields of aging and disability, are organizations, whether they're health plans or individual consumer groups, who are really looking at how technology can be person-centered, start with the consumer. And I'm really interested in the future for us of how you will interface with an app that's put on someone's smartphone, and how you can provide services in that way, and how we will measure the outcomes. We've been talking about, at my office, the future of the nutrition program, and at some point whether or not we should have electronic ordering and tailoring the menus. I mean, how do we use this kind of technology that interfaces with the consumer and caregivers as a way to communicate. So this field is huge, and I think this third part will be a good conversation for you all to have with Sharon. She's really trying to figure out how to help us organize that across the domains within ACO, the use of technology. So I mentioned outcomes, and how we build outcomes in all of this is important. This, to me, continues to be the thing that matters most. Whether you're talking about technology or you're talking about business acumen, but outcomes. And this is the area in which the aging network was the farthest behind. And we are still dealing with that. And I always give this great example, and that's the meals program. We love the meals program. We can tell you how many millions of people we have provided services to, we provided meals to for 50 years. Our outcome measure for that program is an experience-based anecdotal measure that says, did this help you stay home? That is not the same thing as an evidence-based program in today's world. It's a program that's a good practice. It makes logical sense. We helped people. We helped them stay home. They needed a meal. They couldn't prepare their meals any longer. But we don't provide all of their meals. We provide a percentage of their meals. We may provide only 5 meals of 21 meals a week. What is the outcome that we can show in an evidence-based fashion? This has been the weakness of the Older Americans Act programs. And AOA paid attention to that. Josefina, when you were there, you all were working on this issue. How do we build basic evidence-based practices where we can measure outcomes? I am very excited about your entire morning, tomorrow morning, where Kate Lorig, Dr. Lorig comes from Stanford to talk about evidence-based programs. We made a decision 2 years ago to require all of you, and this was not universally loved, this decision, with my staff or with you. We made a decision that you could only spend Title IIID, your health and prevention programs, on evidence-based practices, because we have to be grounded in outcomes. And that was the smallest pot of money in the Older Americans Act. It was the one where the historic investments, and AOA has been focused on this for more than a decade, where that range had been developed. It's related to the work that Dr. Lorig is talking about tomorrow, where we have ability to help handle chronic disease and exercise. June walked by, home meds. I mean, these are the issues that you all have helped develop. We embedded those into Title IIID. So we required, you can only spend your money on evidence-based. Let me scare you to death for a minute. Are you ready? Because this is a way to make sure you're awake. What if someone someday in my job said, you couldn't spend any Older Americans Act money unless you spend it on an evidence-based program? We're not there yet. We're not there yet. But I think that conversation should come. I mean, this was huge for you in Title IIID. But we have to build outcomes, and those outcomes have to be reflective of what happens on the end in addition to an output. And so we have to continue to find a way to make investments. What's become very hard with the budget that I manage is that a lot of those programs were developed with the discretionary dollars that we had in Title IV, and those dollars have really been eliminated. I have made that tough decision as I've tried to protect the base, the core funding, since I've been in Washington. But we really need innovation dollars. It's another area where foundations can be supportive and helpful to us. How do we build innovation? I think if you looked around all the different sections of the Older Americans Act and thought, well, beyond Title IIID, where do we also have a lot of good, strong evidence? It's with family caregiving. And I had an opportunity to talk to people with the Rosalind Carter Institute for Family Caregiving 3 or 4 years ago. And they said, you know, there's a lot of evidence-based practice for family caregiving. The problem is that it's not complete, that about 60% of the evidence-based work in that space is for people with Alzheimer's and dementia, and we have a broader portfolio of need for people. So we need an evidence-based program for how you help someone with cerebral palsy and Lou Gehrig's disease and Parkinson's. I mean, we need things that are beyond Alzheimer's and dementia. So continuing to work on evidence-based programs and measuring outcomes is the key, because it is how we make the business case in a different way in order to get funding. I can't get funding for us very easily, ever, but I certainly can't without being able to demonstrate evidence-based programs. So we understand that this is critical. The other thing that sort of sits alongside sort of our world in terms of moving into evidence-based program is that this dearth of information is not unique to us, but really is an indication of the broad landscape of home and community-based services, that we don't have adequate quality measures for home and community-based service programs. And that's also something that needs to be developed. I can give you an example. So we all believe and support helping an individual or providing support so that they can live in their home where they want to live, and that this has a value to it. This has a quality of life component to it that we should treasure and support and pay for. How do we measure social inclusion and demonstrate that that's a value? How do we measure a person-centered or person-directed approach to care? This whole field is now starting to emerge. And our partners at HHS understand this. CMS understands this. AHRQ, the Agency for Healthcare Quality and Research. We've had good conversations with the National Quality Forum in the last year to say, you know, we need to be able to take credit for and deliver and value more than clinical measures, but the quality of life, of looking at a person and what we can provide to them and support them. We talk about, in the meals program, the touch, that we deliver a meal to someone's house and we can see them, that there's an assurance in seeing them. How do we boil that down? How do we create an evidence-based program that demonstrates what that assurance means in terms of an outcome that we can then replicate and prove that what we've known all along is true? And I'm not saying it's not, but we have to have a different kind of standard, and that this should be type of quality measure that all community-based services should then kind of incorporate the value of being in the home and providing this support. The other problem in this space is that there are not clear pathways, Kate could tell you this as much as anybody, for getting this evidence-based work to market. I ran into Dr. Anand Parekh, who works with Howard Co., and he has really led the Office of the Assistant Secretary for Health in talking about evidence-based programming. And he's so frustrated. I ran into him at an event recently that Edwin Walker and I were at. And he said, there's a pathway for drugs. There's a pathway for devices. You can go to the Food and Drug Administration. How do we take the work that Dr. Lorig is doing and incorporate it in all of the payment systems, in all of the health plans? If we had a drug that would help with the outcomes that she delivers for diabetes, we could get it to market. We could get CMS through Medicare and Medicaid to pay for it. There's not a similar pathway for evidence-based programs. And bringing these things to market continues to be a struggle. They're in the room, there are a group of you, and they will all be there tomorrow, I'm sure, who have formed the Evidence-Based Leadership Council, the partners and the developers and the researchers who've really come together to say, we have a whole platform of supports, of interventions and services with an evidence base. How do we go with you, take them to health plans, because you're the place where these are delivered? And this is something that you have to offer as you do your analysis with business acumen. We can deliver these programs, we can show these outcomes. So I think this continues to be an area where we need to grow. So everyone go see Dr. Lorig tomorrow. She was in our office fairly recently. So I want to return to my comment about creative chaos and talk about a couple other things that might be new. But I thought I would take a moment, because it's time, everybody's had time to get here now, and find out who all I have in the audience from my own staff. See, I didn't do this at 8, so I gave them a chance to get here. I just want to know, I want to recognize the fabulous people I work with. We have a lot of people from AOA and ACL here, and this is a chance for them to stretch their legs so you can see them. Well, can I just recognize my staff? I mentioned Edwin because I know he's here, but we have a number of our staff. I saw Carol in the audience. Just stand up. Our regional administrators are here. We've got our regional administrators there. And Costas, and Edwin's here. We have a fabulous team. And when we reorganized a couple of years ago and brought in the staff from the Administration for Developmental Disabilities, they said, "Are you all really this nice?" It's like, we are. We're really this nice. Yeah, it's a great place. It's a great place to work. So I hope you take advantage of the fact that we have so many staff here, that they want to be here and interact with you. We're doing a lot of different workshops while we're here. I think there's time specifically on your schedule to talk to our regional administrators about what's happening kind of in your neck of the woods, the areas that they cover. So thank you, staff. So let's go talk more about creative chaos as we have more coming. Yeah, I know what I'm going to talk about next year, Sandy. I'm going to talk about this next year. So I can tell you that ACL is about to change and grow again. That last week Congress passed, this is how fresh this news is, and this is why my last week was a little different. Last week Congress passed the reauthorization of the Workforce Investment Act. And as a result, there are 3 programs that are currently at the Department of Education that will be transferred to ACL. And we quite literally are waiting for the president to sign this legislation. This is a result of advocacy by many of the advocates in the disability community, as well as the support of Senator Harkin. Senator Harkin is retiring at the end of the year, and he was determined to make these changes before he left. So I want to go through with you the 3 new programs that are coming to ACL. First, we will be the agency that now administers the grants for Centers for Independent Living and the statewide independent living councils. Yes, these are the CILs. You all have the CILs in your communities. You've been working with Centers for Independent Living. The purpose of the CILs and the Independent Living Program is to really maximize the leadership, empowerment, and independence of individuals with disabilities and to integrate them into the community. We help them provide programs, and then they provide grants to consumers across disability. You all know the CILs. We've been working together to create partnerships in local communities for a long time. And as we move forward to reorganize again, we will incorporate the funding for the CILs. The National Council for Independent Living, their national association, is meeting in a couple of weeks. I've had a chance to speak to them before. I will speak to them now. They are very excited to join the broader mission with ACL, to partner with you all, and have really been the ones to generate this move, because they see that the mission that is broad and inclusive, but also very succinct, supporting people and their independence and dignity and autonomy is where they want to be. And they felt that ACL was a better fit than the Department of Education. So this is really brought to you by the advocates who want to be with the rest of us. The second organization that comes is the National Institute on Disability and Rehabilitation Research, NIDRR. New acronyms for you all. NIDR. NIDR is the main federal agency that supports applied research, training, and development to improve the lives of individuals with disabilities. NIDR is a research institution. Their staff generate grants and research, and they are very unique in this space, very well respected. The main concern that I've heard both from the staff at NIDR, the Department of Ed, and the advocates is, please don't change NIDR. It's like, oh, we would never want to. They're doing disability research, disability regardless of age, and translating that research into community. We had a wonderful conversation with them several years ago about aging with a disability. They bring to ACL a research institution that we never had before, and provide specific investments to scientists and researchers in community. Those of you here who are building evidence-based programs, those of you with the Evidence-Based Leadership Council should look them up, get to know them. They are new partners and colleagues as we talk about building evidence and translating that evidence and showing what works for people with disabilities of all ages. We're really excited. I mean, I ran into a former staff person last night. She says, oh, NIDR's coming. I mean, the fact that NIDR's coming and the CILs are coming, this is all very exciting. The third one that comes over is the state grant for assistive technology programs, where we will administer money to states. States then provide assistive technology supports for people with disabilities of all ages. And the state AT grant program makes devices and services available to individuals with disabilities and their families. And Sharon may talk about that more when she comes, because we're also very excited, since we've identified technology as a need that we have, to have these 3 programs. So we will change again, and we will have more staff. We will be bigger when I see you next time, and we will continue to have, under our big tent, the essential community-based aging and disability programs all in one location. And we will have aging, and we will have disability, and we'll have the things in the middle that serve both, such as the SHIP program, the State Health Insurance Assistance Program, that serves people on Medicare, which we now have. This is huge for us and robust for us. And you might go back and just do your own kind of calculation on who you know in your state that is now part of our big umbrella, because it's the DD councils, and it's the PNAs, and it's the CILs. It's the USEDs. These are all new acronyms, the people who are being funded from NIDR. It's the AAAs, it's the state units. It's the meals programs, all in one big tent. This is a lot of change. And we're not changing just for the heck of it, because it's a lot of change. It's a little chaotic, but because of the mission that we have, the sense of service that we have to people with disabilities and older adults, family members, really the whole community. And each of these programs has come down a different path. We've talked about this since we created ACL. This isn't about making everybody the same. People with disabilities and people who are aging are having different life experiences, but there's so much in common in terms of mission that this is a good fit, and we can continue to support dignity and independence. So this will be fun. So the future is a little certain and a little uncertain all at the same time. So I'm very aware, and I mentioned this just briefly, about where I am in space and time. We have 2.5 years left in this administration. There will be a point when someone else will be invited instead of me, to at least do this part. And I've been quite focused on what my priorities are in the next 2.5 years, so I wanted to share those with you. The first two are obvious. I've talked about them. The third one's obvious too, because I haven't talked about it yet. All of this transformation will continue to take a great deal of our time, my time, the staff's time, your time, as we continue to change and evolve these programs. So managing all of this will continue to be one of my top priorities. The White House Conference on Aging, the opportunity to really talk about and frame aging, to lift up the issues, to get out in the country, to get involved directly with you all, to hear from older adults themselves. This will be a second big priority. And then I will do everything I can, and Nick mentioned this in the opening, to continue to advance the cause of elder abuse. We got the $10 million in the Senate budget, but you've seen me struggle with this by now. Getting it out of the Senate and out of the House and into my bank account, those are different endeavors. We have a long way to go before we actually secure this funding. It has to pass the Senate. We have to have some sort of budget. If Congress doesn't pass a budget, we have to find a way through a continuing resolution next year to have this money included. Elder abuse continues to be the passion that drives me personally, because I simply have run across this as a professional my entire career. It will take all of us. I'm so pleased to be here this morning with Paul Greenwood. It will take all of us to work on this issue, and this issue is hard. So I want to just talk about what you can do, the specific things you can keep doing. And I want to tell you, I see you. People send me your things. Do you know when you have a local event for World Day, people send it to me? And when you do a blog, people send it to me. And you are my outcome measure, that I can tell when I talk a lot about this that you all are starting to act because you're doing specific things in communities. We will continue to focus on World Day, June 15th, every year, World Elder Abuse Awareness Day. I did 3 things this year. I did a community event in the community where I live in Rockville, Maryland. Did a wonderful community event. One of the best things about that community event was it involved older adults themselves, really at the heart of the event. We talked about elder abuse. We have every county official on the stage with me from Montgomery County, Maryland, talking about their commitment, including their state's attorney, their state district attorney, all committed to this issue. We did an event on the Hill to highlight the appropriation in the president's budget to continue to work on getting funding for both adult protective services and research. And I went up at the request of Acting Commissioner Carolyn Colvin to the Social Security Administration, and I did a presentation and a pitch to all 68,000, Edwin's helping me, 68,000 Social Security employees. If we could get the SS employees to help us identify people who are being abused, we could move this. You'd feel it. It'd be like a little earthquake, just to have SSA. So Carolyn is a wonderful colleague. I see Ben, who works with her, hanging out back here by Josefina. Carolyn has now been announced. They're going to put her through confirmation as the permanent commissioner. She's very, very committed to working on elder abuse. And so having a chance to really make this call to all SSA employees was really important. Last week, the Department of Justice and HHS published and announced a roadmap, an elder justice roadmap. I do encourage you all to look at it. This was a project funded jointly between ACL and our colleagues over at the Department of Justice to really give advocates and experts an opportunity to frame for us as a nation what's needed in this space. And it covers everything from research to what we're going to do to support people with Alzheimer's, to the need for adult protective services, to screening, to law enforcement, to training. It's very comprehensive, and I would encourage you to look at the roadmap. I would also suggest that at the state level, we need your help to build broad coalitions of support for adult protective services. What we're trying to do on the federal level is show up, because this is only a state endeavor, and we believe the federal government should be supportive. But adult protective services need you in your state to provide support for them and advocacy for them and to validate what they're doing. Adult protective services is really the key government safety program to respond to abuse of older adults, younger adults who need their services. So I would encourage you to support APS. One of the things that I found most amazing, as I've been really talking about this very vocally for several years now, is that everyone says yes. Everyone shows up. You're showing up. Thank you. Everyone says yes, except this one email I got recently. Tackling elder abuse is very, very hard. There's not one thing that will fix it. There's not one person who's in the way. There's not one system that needs to be fixed. It's all of them. We need screening, and we need prosecution, and we need training, and we need prevention, and it's hard. I spoke recently to the board of AARP. It was an honor to be asked to talk to them. I talked to them about elder abuse, because AARP is looking at financial exploitation as sort of their role that they can play. And I said, you all knew about this before I got here. You knew about this before I got here. You knew about elder abuse. People in the field of aging have known about elder abuse, but we've been so paralyzed because it's so broad that people haven't known what to do. And all of you have responded, except for this one person. And I reached out to someone recently within the last month to say, can I come talk to you? I'd really like to change the world. And they said, you know, it's just so hard. And they were the first one to say no. And they came from the field of aging. And it was really shocking, because it's like, you know, we've known this was out there for a long time, and I know it, but I don't think I can help you. So it's work that needs to be done. Not all the people get it. Most do. Most people that I've asked have been willing to show up and help in some way. So what I need for you to do is very, very basic. Don't be overcome by the complexity of self-neglect and abuse and sexual assault and financial exploitation. Don't be overwhelmed by the systems that you need to talk to. There's a lot of you. Do one thing. Stop being paralyzed and just act as you are. And we all need to keep doing one thing. And we need to keep raising the profile. But if you build a coalition or you do something for World Day, can you hear the difference? I can hear the difference in the last 2 or 3 years that collectively we've been able to raise this profile. Just act. Don't overthink it. Just do something. I really do think we can change the world. And I think that's what's needed. And next year for World Day, I've already reached out to someone to talk about the world part and how we can engage the United States State Department to do more around the world. We need to change the world, but it takes action. So that's what I need you to do. There's a lot to do in this next year. So you need to roll up your sleeves. You need to put on your boots. It's going to be a wild ride, but it's good to see you. I'll see you again next year. Okay. If you have time. Sure. Do you have mics around? Do you recognize our strange sign language up here? We have some time for questions. I don't know if you have people with microphones in the audience who will fly across the room. Back there, up here. Here's a question in the front.
Excuse me. My question is, you had mentioned earlier about the sills coming under the umbrella of your administration. On community living, I don't mean your administration like president, but, but that would be good. Nevertheless, my question was, will the sills then be, the word I'm looking for, brought into the No Wrong Door initiative and network, and then, moving into all of us using, similar databases and, to move along the process of sharing information electronically? Because I think that's one of the barriers out there with the No Wrong Door initiative is the SILs, coming on and using the various databases that we're using.
So we all know the SILs. Independent is sort of their first and last name. I'm not trying to be coy, but we need to ask them because they're very self-directed. And the SILs and the AAAs are slightly different. I mean, these are organizations by and for and of people with disabilities and need to talk to them about where they currently are. I mean, the President hasn't signed the bill. That's just how new it is. They're looking forward to more conversation. I don't know an answer for you with regard to No Wrong Door. Where it's come up more specifically has been with regard to the issues of business acumen. That as we've been doing this work with some of the partners on business acumen, this whole arena that you all are engaged in, the SILs have different businesses and different business models, and we've been engaged in conversations with some of the leadership from their network about what this transformation means for them in terms of business and system. They are concerned, like the rest of you are, about not losing mission. And now, becoming a business is sort of different. So we'll wait to see. I mean, I think everybody being together just provides more opportunity. And there are natural connecting points, such as business acumen, such as technology, that will bring us together. And from there, we'll see kind of how far we can go in terms of conversation. The goal of the No Wrong Door system from the beginning and the ADRCs is that we have a single point of access and entry, and we kind of need the SILs to be part of that broader conversation and resource. One of the areas that's been hard has actually been in the world of people with developmental disabilities and those systems because they're a little bit different. It's kind of a provider-based system. So we'll just keep figuring it out together, but certainly the need is there, the need for community is there, and if there's an organization who has at heart and soul the support for independence, it's the SILs, and they will bolster that for all of us. I can't see very well.
Thank you again for coming this year, Kathy. Always a pleasure to hear from you. I'm from Western New York, and we talk about communications and now blending offices for the aging or AAAs with healthcare plans and health systems. And I'm finding in this changing world that that's even easier talking with my healthcare providers than it is to talk with my own departments of social services, departments of mental health when we share clients. How can we get to this client-centered approach to serving people in government if government agencies can't talk to one another? And what's being done on the federal level to kind of break down those silos?
What's being done is some, but more needs to be done. So Martha was here, so let me give a shout out to Martha and Nashwood. Let's just start with the state units on aging, because the state units on aging themselves all are very different from each other. And there are state units, the ones administering the Older Americans Act, who do that, who do not run a Medicaid program. And so one of the first goals is to make sure that the state unit and the Medicaid program connect with each other and talk about what they're both doing for older adults. I've been talking a lot about adult protective services. It often exists someplace completely different. About half of them are with the state unit, a half of them are with social services. I think our work, is how I guess visualize it, starts with the core of the Older Americans Act, expands to Medicaid, but as we're continuing to do more work, the next leap is to have conversations with the broader social service agencies like you're talking about. I think that is emerging. American Public Health Service Administration, APHSA, I don't know their full, and also public health. So I think public health and social services is just the next conversation. I think it's important that people start mapping where all of these functions are taking place at the state level and figuring out what the opportunities are to bring them together. But the world is getting more complicated at the state level, and every state looks so different. There's actually more variation there than there is even in community, where you'll have a AAA and some of the basic community services. So there's more to do, and interoperability there is very challenging if you're talking about technology. Just from my own experience when I was in the state and we were dealing with legacy systems and the systems that lacked interoperability across social services to aging and to Medicaid. Not every state will have an interoperable system, and at a time when state budgets are challenged, it's very expensive to build and deal with the kind of the legacy systems that were built initially from the main public service welfare kind of poverty program. So it's just more. I don't have a good answer for you, except that that's where we need to spend more time, I think, and build state partnerships and look to the state leaders who are here to figure out how to do that. So it's also complicated at the state level. The ACA has made state conversations complicated in the last several years as well. So. Yes, I see you, and there's 3 of you. Is it like 3 questions, or have you divided up?
We'll share here.
Okay.
Recently, you had staff in San Francisco talking to us about data collection related to elder abuse. And I was curious as whether or not collecting data related to that will go forward, whether or not the 10 million comes.
So we have started on this already. It's part of why we were there. We get money from the Public Health and Prevention Fund, and I have some ability to make some decisions about how we divide that money. I can't do very many things just sort of by fiat, but I was able to pull out about $1.5 million to start the process of building a database. So we have a contract in place. We're working with another department from HHS, the Assistant Secretary for Planning and Evaluation, and we are working with 10 states specifically, and we've had kind of a technical assistance program developed. They were just in our office in the last about 3 weeks to talk specifically about what the fields are. I mean, this is really weedy data stuff. What are the characteristics of the victim, the perpetrator, the abuse, the outcome? How do we start finding out what the field should be in a database? We are doing that work, but we can then come up with a database that is not implemented. So we have enough money to do the basic database development. What the $10 million is for is to provide support to states to begin the interface. We're talking about the difficulty of kind of interfacing and the complexity of paying for it. If we're going to say to California, which is a great partner with us, okay, we've got something here, can you try the interface? Can we start to build it? We'll need to give California some money to change your systems to make them connect. Even if we're able to get the whole $25 million, which is what the president recommended, about half of it was for the purpose of building this system. We wouldn't have a national system. We don't have a national template at this point, and we will be able to get the template, but if you all can't use it, then it's really not going to get us anywhere. So we have to find a way to be able to move state to state. And if the money doesn't come, sort of the backup would be to say to all y'all, since I'm in Texas, do you have any money to do this yourself? Because we've got it here for your use. We have to have it. We need more data on what's happening. And you had a question.
Thank you for your leadership. You mentioned best practices, and there are so many new technologies that I think community organizations are being bombarded with. I wonder if a leadership role exists for setting a best practice to force technology vendors to be interoperable so that community organizations don't have to think about, I'm going to pick one little one here and one little one there, but actually just say, let's not reproduce the problem that the Epics and the Cerners have created in the medical world for the community organizations, but rather, let's just pick off the best part of each technology and have all of them be required to communicate with one another.
So the reason why I decided to talk about chaos today is to demonstrate to you that there's the answer. That is happening to all of us at the same time. Now, we have a great partnership with Karen DeSalvo and ONC, and are working to put together kind of an all-day event or workshop where we can really compare what we're seeing coming from our field in terms of community and technology and her field in terms of health and technology. What we're trying to figure out, both at AOA and then the broader ACL, is what's our role here? Because we are not providing any funding, we're not any sort of regulator, and it's basically back to, can we be a convener, an organizer? What is the leadership role that we can play? The business acumen work is a good example. We're all doing this work we were never given any extra resources to do this work, which is why the foundations have been so essential. So how do we move forward? And we would welcome your sort of input on where you think we can go, because we're not the boss of anyone in that space, but we can get people to come to meetings, and where do we need to go and what's our role. And we're also, so that's the whole sort of business aspect of it. It's the same thing with regard to the interest from the consumer side with these new applications and devices that support independence. So there's not kind of an organizing principle around that, and how can we be involved? So.
I think you may not be involved with that, but the consumers, the AAA's buy clause, because they buy.
Sure.
They come together and say to all the vendors, we will not buy unless we talk to one another. Vendors will listen.
So I hope you all know this by now, but it's okay for you to tell us what to do. Oh, I'm serious. I mean, you can come forward and say, okay, we need your help here. I mean, you should. Because we had a brown bag lunch 6 weeks ago saying, what's everybody think? I mean, it's the same thing. We see it coming. What's our role? And since you're on the ground, and if you're doing the negotiation and you think there's something, you should tell us. Because we're nice, as I pointed out. We'll see if we can help. Do you have the mic? No, we don't have the mic. I'm real big into making sure people can hear.
Okay. You talk about evidence-based practices, programs to support our work. Will the ACL be giving some guidance as to how we define what is evidence-based? I just hear the term used very flippantly. Oh, this is evidence-based. Somebody wrote a paper, so it's been peer-reviewed. Will ACL give some guidance so there's some really definition to what is an acceptable practice that's been researched and evaluated properly, rather than just flippantly saying, well, this is evidence-based?
We did provide, it's on our website. Edwin says it's on the website. We did provide this, because Edwin was the key person as our Deputy Assistant Secretary, providing guidance when we moved to that requirement for evidence-based in Title 3D. And when we moved that out, we came up with 3 categories, really trying to give people a chance to kind of advance, and are finding movement towards the most rigorous category at this point. We've also done this work with, someone give Edwin the microphone, because I'm just not translating. Edwin, let's let you talk. I don't have all the answers, Edwin does. So, Edwin Walker.
Hi. We have provided we've taken definitions that have been used in other places, and we really adapted them for the Aging Services Network. As Kathy indicated, we wanted to make sure, because the change came about in the middle of a fiscal year, that we wanted to make sure that no program that people had would have to be eliminated at that point in time. What we've done is we've conducted webinars, and those have been archived so that you can go and access them now. But the definition is there. We can provide you technical assistance from any of our regional offices, and would be very happy to do that.
Okay. I'm just looking at my timekeepers. I want to make, there's a couple more. Let me make a comment about Paul before you go like this. So, Paul did something that I asked him to do that was just very special for me. When I went to San Diego in March to the American Society on Aging conference, I asked him if I could talk to some of the elder abuse victims that he's worked with in his office. And we did that. He pulled together a meeting, 6 victims came. It's important that all of us be grounded in the work with the real people, and that's harder the longer you're in Washington, to see people directly. I have worked with people who were abused, clear back, that's why I'm so passionate about this, but I hadn't had a chance recently. And it's moving, and if you find anybody who's not motivated in this work, you should have them sit and talk to victims. It helps me because I talk specifically now about the woman who was the veteran who cried the entire meeting, and the woman who was a victim of the grandmother scam, grandparent scam, and people who were victim of the home mortgage scams. And this really breathes life to us and our work, but also provides good stories in a way that's appropriate to share this. And so I just wanted to thank Paul for doing that, because it's really meaningful, and I just wanted to thank you publicly for doing that. However you want to go on. I'm just keeping time. Hey, Sandy's coming. Thank you all.
Thank you.